You might be wondering what GBS is, or Group B strep, and why it's important to know before you go into labor. GBS is a type of bacteria that we test for. It's a little swab that they put inside the vagina and the bum. We send it to the lab, and if it grows the Group B strep, then we know you're positive for it. This is something that you won't necessarily have any symptoms of. It's just a bacteria that lives inside some people's bodies. Other people don't have it. So it's random. The reason why we test for it is it's important because it can be passed along to the baby, and it can really seriously impact the baby's health. So it doesn't impact mom's health, it just impacts the baby's health. While you are in labor, if you're GBS positive, we will give you prophylactic antibiotics. And this just means we'll give you antibiotics through your IV, and this will help to protect the baby from the bacteria, so that way they won't get sick. If your water breaks and you have been tested for GBS and you are positive, I would suggest, and most of your other healthcare providers would suggest, going to the hospital right away. This way we can test if it actually was your water that broke and if you're in labor, and that way we can get the antibiotics into your system before you deliver the baby. If you decide to stay at home and wait, then it puts a little bit more of a risk that the baby won't get those antibiotics before you deliver. So it's a personal decision, but ultimately most of your healthcare providers, if you are GBS positive, will tell you to go to the hospital in a timely manner from when your water broke or when your contractions started, especially if it's your second, third, fourth baby. You're going to want to get to the hospital pretty soon. I have a lot of patients who, unfortunately, if it's their second baby, they usually don't get the amount of antibiotics that we like in their system before the baby is born. If that's the case, the pediatrician just monitors the baby for any signs of infection, and we keep a close eye on the baby. But it's most of the time not an issue, but for those few cases that it is, we like to keep a close eye on them or get those antibiotics into the system ahead of time.